unfortunately, COVID is actually still possibly the main story in the news. Unfortunately, who would have thought 2 years in and COVID is still ruling the news cycle, and that creates a lot of different difficulties because part of the reason I think that some people are losing the seriousness around COVID and not doing the measures and whatever, is because it's lasted so long in the news cycle. A lot of the alarm in it kind of is gone by now. It's like if an alarm went off and nobody ever turns it off, so the alarm stays on. Eventually, it's annoying. It's drawing your attention, but you could get to ignore it after a while. And I think a lot of that is happening with COVID. But it is still very much in the news. People are dying from it. And as all around the world, probably the majority of the news around COVID doesn't really have to do with the virus itself, but has to do with the several measures that are being done all around the world to cope with this virus and to attempt to live with it, or in some places they were attempting to get rid of it, but it seems by now that is known to be a foolish and impossible choice. So the main thing many people are doing now, the main way out of this pandemic, as said by pretty much every government on earth, is by vaccination. We vaccinate everyone, and that's how we get out of this. Personally, I find that to already be proven to be not 100% effective at actually getting us out of this. The vaccines have been proven, again for the millionth time to say it, they've been proven to decrease the risk of serious illness and hospitalization. So if you're trying to decrease that risk in yourself, it makes a lot of sense. And if as a country you don't have the necessary hospital space to risk that, then you could understand why on a countrywide basis vaccines would actually be very important also. But I don't agree with mandatory vaccines. I've said that over and over. I think I've exposed the reasoning for this so many times already. But it seems the direction many people are thinking that it's necessary to go. And one of the very unfortunate things with this, I think, is that many places are going to find out several things. That one, when they do mandatory vaccines, not everyone is going to get vaccinated anyway, so you end up punishing people and still not getting the result that you wanted, because if the people do not get vaccinated, they're still in the country and they still pose whatever risk you think unvaccinated people do pose. So that's one. Now they're unvaccinated and unemployed and on the breadline. I don't think that is of much use. And I think also they may be putting themselves at risk in the future if these cases haven't yet been decided in the courts. There may be some future risk to this. And one of the primary ones with that we're starting off with now is that Republic Bank is threatening their workers. And the thing is, that case is in the court. From the Guardian newspaper, 300 Republic Bank workers threatened with termination. About 300 workers from Republic Bank have been threatened with termination if they fail to get vaccinated or if they fail to provide a PCR test. This was revealed by the second vice president of the Bankers and Insurance General Workers Trade Union, BIGWU, Jason Brown, during the final sitting of the Joint Select Committee on Social Services and Public Administration on Wednesday. The GSC's objective was to look at unemployment during the COVID-19 pandemic and assess the state's capacity to provide support to unemployed people. But Brown said conglomerates like Republic Bank have initiated vaccination policies that had caused anxiety among staff. It's no end of woes for workers, Brown said, adding, Republic, one of the largest banks in the country, is unilaterally deciding to have workers engage in mandatory vaccines, or if not, to provide them with a PCR test at their expense, which is unaffordable for these workers. Now, this is another side of this. This union leader was in Parliament, or I believe it was held in Parliament, a meeting with the Joint Select Committee of Parliament, and what they were discussing is the government's ability to provide for unemployed workers, for people who cannot be employed at this point in time. And we're talking about some of the larger conglomerates talking about making more workers unemployed. That doesn't actually add up. Over in Antigua, I don't have this article pulled up, but you could take my word on it and you could go look in Antigua news to find it out. Their prime minister had to roll back some of their vaccine mandates, and the reason he said was a matter of mercy. And even if it was really a matter of mercy, it shows the reality that in the position you are as a government, for you to enact mandatory vaccines, and bearing in mind, unless you're going the route of where Austria wants to go, where they're actually looking to force people to become vaccinated, that's kind of far off the deep end. If you're talking about mandatory vaccines where it's coercion basically, and if you don't get this vaccine, then you don't get to go in this place, then you may lose your job. Then you're going to end up with unemployed people in the country. And when there are unemployed people, who has to take care of the unemployed people in the country, according to our government system, is the government again. So really, what does that solve? He also said there were 10 matters before the industrial court, all related to the pandemic. These matters are going to be heard on February 1st and February 10th. Yet the workers from Republic Bank who have not received the vaccine or have not been able to provide a PCR test, which they cannot afford, these workers will be suspended in January, before the court date in February, he said. Because of the influence of Republic Bank, he presumes that many other private companies may be following in suit just like Republic Bank once they do that. But I wouldn't advise a private company to do what the bank is doing, because banks have much deeper pockets than some of these other private companies. And if perchance, because suing generally wasn't a common thing in Trinidad, but the more news that I read these days, you're seeing more people catching on to it, and every year there's a whole new influx of lawyers graduating out of the many different law schools around the Caribbean, and Trinidad is not short on lawyers. So maybe some of this would be creating some work for them, because I think if a matter isn't yet, I do not know the specifics of this matter, but I have said previously and I have spoken previously on the head of the industrial court's stance when it comes to these mandatory vaccines. And she has made that pretty crystal clear. If you have workers who have already been employed under a specific contract, it may be very difficult or illegal to just change that contract to include some kind of vaccine mandate. And I don't think that vaccine mandate would be able to be filed in under the health and safety provisions in most jobs. So if the case is that you suspend these workers in January and then you lose the case in February, maybe, because I'm noticing that they're saying suspend the workers, so maybe you just have to call them back out. But I would think they may still have some legal redress if there is some loss of opportunity between the time from January to February. That's just what I think. But let's see what the bank had to say on some of this. Contacted for comment, Republic Bank's General Manager of Group Marketing and Communications, Karen Tomyu Jardine, said the bank has outlined a clear return to work policy, which has had the desired outcome of producing a workforce that is 92% fully vaccinated. She added, staff are expected to comply with this and all other policies set by the bank. The bank continues to educate its remaining unvaccinated, and educate people on the vaccines. Great, Grant. This was one of the points, I believe I made this in a video earlier on, this point that I made. To many of the anti-vaxxers, many of the people holding out on being vaccinated for whatever reason it is, I suggest that you solidify whatever reason that is. And if it's not a good reason, well, you make a decision based on knowing that you aren't really having a good reason. You don't really have a good reason for this. Or if it is a good reason, then be ready to stand with it. Because what you'd notice happening is Republic Bank put out this general policy. And the manager said it there. It had the desired effect of getting 92% of their staff fully vaccinated. And if you get 92% fully vaccinated, then that 8%, they're in trouble. But if that number stayed somewhere around 60%, now I'm not saying that I wish for this or this should have happened. It's just a hypothetical. If that number did stay around 60% or even 50%, then the firing or releasing of those workers, the other 50%, that chunk of workers, would have been way too much, very likely, for the bank to do, and the entire policy may have had to buckle under that. But when you have the case that you can be coerced into making the decision, you have 92% of the workers deciding to do this. Maybe it's a good thing because they didn't have much good reasons anyhow. But part of the result of that is making it nearly impossible for anyone else to hold out. I think the more effective these measures are the more effective they will be. It's kind of obvious, but it's true. If you tend to see many people acquiescing to the demands and to the coercion techniques being done in and around this entire vaccine mandate, etc., you're going to see more of the technique used. That's just the way I see it. But as I keep repeating over and over and over, I think a large part of this is misdirected. A large part of the effort is being misdirected. And the amount of effort being placed on the unvaccinated and a pandemic of the unvaccinated and all the other sayings that are being coined to try and coerce people into this. First off, I don't think a lot of it is changing many minds. As we could see, a lot of the vaccination numbers have slowed down. If you want to really coerce people, then you have to be in a position like Republic Bank where you could tell them you ain't going to get your money if you don't do this. I think that's an immoral act personally, but it works. Let that be whatever it is. But as I said, I think a lot of it doesn't have to do with the vaccination, etc. It has to do with people obeying simple guidelines and simple rules about if you're sick with anything. Anytime you have something that is contagious, if you're sick with it, you stay away from people. I thought this was obvious stuff ever since primary school. If you get chicken pox, you stay home. If you had a cold, you could drop a comment in the comments or in the chat and tell me if this wasn't something very common in the school days. As far as I recall, if you had a cough or a runny nose, the general rule of school days, since you were this small, was you stay home. And many people aren't listening to that. And I think some of it has to do with some of the danger and the seriousness being aimed at, rightfully sometimes, at COVID. So some people do not want it at all to be suggested that somehow they have this disease. And then the reality of it also is if you do have it, and 2 weeks out is a lot for some people who are struggling to make ends meet. So I think a lot of the mistakes are happening in that vicinity, with people who know they are sick, with people who are feeling sick and are still deciding to go out into the communities. There's a case here, and I find it difficult many times when I see stories and people blame someone for someone else's death with viruses and diseases like this. That gets into really, really troubling waters to me. But I can understand it, especially in the moment of grief. COVID-19 positive neighbor blamed for pensioner's death. On November 30th this year, Marcus Hunter and his sister Rebecca Corby got the news that brought both their worlds to a shocking and unexpected halt. Their mother, Bernadette Teat, had died as a result of COVID-19. What made the devastating news even more surprising was the fact that the siblings did everything in their power to protect their unvaccinated mother. In this case, their mother was unvaccinated. But they were looking and they were trying. They went through some of the measures they were doing. They had her isolated. They had her distanced. She wasn't leaving her house. She was on her own quarantine. They were bringing in her groceries for her. So she had herself tucked away. Personally, I think that kind of measure, unfortunately, for reasons to be told eventually, it didn't work out for this specific pensioner. But I think that should be some of the main measures also. People who know they are at risk. If you know you are in an at-risk group, you have your comorbidities, you are older in age, then you shouldn't be looking out expecting the entire world to shut down so that you could stay alive. Maybe you should be seeking to put some measures in place for yourself. That's kind of how the world always worked. If you're at risk of something, you cannot expect the entire world to nerf themselves and do whatever measures need to be done just to protect you. People generally do the measures to protect themselves. So I think those at risk should be looking to protect themselves. Tate's next door neighbor, Sharice Jeffrey, said simply answering her door is what may have led to her eventual demise. Jerry recalls seeing another tenant on the compound, reportedly a COVID-19 positive nurse. That's kind of very unfortunate. Speaking closely to Tate by her doorway without a mask on. I clearly remember the neighbor came home and was like, "Miss Tate, I nearly dead," as she saying that she is less than 6 feet apart from her. And she had on no mask. 2 days later, Miss Tate started to feel ill, Jerry explained. The children said it did not take long for their mother's condition to deteriorate. As her situation worsened, Corby said on November 27th, they called an ambulance, and listen to this, but it arrived 2 days later. That's the thing. I spoke about this in a previous video, I believe. The ambulances are stretched thin. If you are in a position now where you need an ambulance, you're putting yourself at a lot of risk. You do not want to be in such a position. So whatever measures you could take to make sure that you don't need an ambulance, that would be very wise on your part. I saw Mr. Manning, the MP for San Fernando West, I believe, or San Fernando East, whichever one. I believe his father was the MP for, is where he is now, and he got COVID, he and his wife. And when you read that story, his wife said she drove him to the hospital, because if he had called for an ambulance, it might have been another 2 days late also. And he got COVID pretty badly. And here's the kicker in that. Why I think some of the focus on the unvaccinated or the vaccinated and all of that nonsense, well, it's not nonsense. That may be a bit too strong. But too much of the focus on that doesn't really make sense. Mr. Manning, who ended up in the high dependency unit in the Couva Hospital, and who, from the accounts given, at least from himself, well, at least from his wife, was in a pretty bad state. At some point, it seemed like they weren't too sure how he was going to pull through all of this. He is vaccinated, fully vaccinated. He and his wife. Now, this tells you something also about how effective the vaccine is at preventing the spread. The fact that many places you're seeing clusters of vaccinated people get ill, which means it's spreading pretty easily among the vaccinated. So whether you are vaccinated or not, you should be taking whatever measures you can to avoid having to call these ambulances that are going to have to arrive 2 days later. That's not something you want. That's not a position you want to be in. That's all I have for now. I hope you were educated, informed, or entertained. And do click that like button if you haven't done that yet. Smash it, click it, stamp it, kick it in, and drop a comment if you haven't commented yet. And do subscribe if you're not subscribed, and share it to whoever you think may like this kind of content. And I'll see you again in the next video.
And you feel the music rising with the time.